Right, I shall be as quick as I possibly can because I've got a few things to say. First thing is, and my whole hand, hold my hands up in the air time. I, if I can find that article on the 60-70% failure rates, it probably won't be trustworthy anyway. Won't be a peer-reviewed paper. The 92% pain was from Leicestershire Hospital. I remember that because of where it came from. I will endeavour to find that one, but I'm going to struggle because that came from a Freedom of Information Act request, and things like that just tend to get deleted because they don't only have to keep them for 3 years. But I shall endeavour to find that one. But there was no accompanying pain scores with that, i.e. 92% at what VAS, I don't know. Now, I didn't intend to be insulting, and I certainly didn't intend to be aggressive. I think that was frustration more than anything. The reason being that one of the articles that I'd have probably posted saying this isn't acceptable is one that you posted saying this is acceptable. I tend to dismiss the 94%, not because it's just convenient, but because we don't do fundals in the UK. And the one person I know that tried, Mary O'Connor, and she's no flyweight, had a VAS score of 10, and she co-wrote a book with Justin T. Clark, who is one of the authors in that and one of the studies published. And they did, in her book, she mentions that in the VAS trial that was done at Birmingham's Hospital with vagiscopic versus speculum outpatient hysteroscopy, they mentioned 25% severe pain, but she quotes 30. However, 5% withdrew, but it is actually in the paper. So to be fair to Justin T. Clark, the information usually is in there with his, even if it's not interpreted correctly. Also know that there's an issue with unfilled in surveys, particularly I know one for MyoSure at Cornwall Hospital. They had a very high percentage not filled in. Well, they're the ones you want filling in because they're the ones that probably in no state to fill them in or find it painful or sick or just wanted to get the hell out of there. So, and I do know that I've been told that sometimes companies will do, they'll have 1,000 patients, but they'll split them into 10 and 100 studies, and then they'll publish those that they find fit their criteria. Well, I know that Justin T. Clark doesn't do that, and others sometimes do. But my question to you is, do you do fundals? Do you monitor blood pressure? Do you say this is often painful / women tolerate it well? Because we find that tolerated well is just a code for they didn't sue. So the reason I said you have no ethics is because the mean pain scores were 7.7. Mean pain scores. How can you say that's ethical? I simply, no, that's not ethical to carry on with the procedure. That, unlike operative and diagnostic, if it's painful, it's stopped. I've never heard it stopped. Also, when it comes to being quick and easy and more time away from family, and so the women in a rush to get back to the sink, are they? And it also doesn't coincide with the testimonies I've been told. I know someone personally, and she was kept in overnight because her blood pressure was low. So what you get in the UK is 23% saying they're not happy with this. When I say it shouldn't be done in outpatient, I never said that women shouldn't be allowed ablations. What I said was this shouldn't be done in outpatient. And when I say outpatient, I mean a UK outpatient, because I said several times, I'm pretty sure I didn't mean a cervical block when I talk about, you kept saying local. I said, and I made a point about fundals, because when I said local, I wasn't including a cervical block. That's a given. I'm on about fundals because Mary O'Connor tried it and had a VAS score of 10. So we find that the pain relief is extremely painful. I don't understand why you're on an ethics committee when you're okay torturing a percentage of women, and it is torture when it's a mean pain score of 7.7. It means you're getting 8s, 9s and even 10s. That's not ethical when there's appropriate pain relief. It's not ethical when it has never stopped because it's a procedure that shouldn't be stopped. It's not ethical when you can, in your country, actually give sedation and I don't mean patches, I mean a proper IV drip. And I was told by an anaesthetist that it's not suitable really for anything truly painful, so you're going to need propofol. But again, I've been told by more than one anaesthetist that spinals are suitable, fast-acting prolocaine, in and out. And I'm hearing quicker recovery times. Now, I don't care whether you disagree with it. I disagree that the sky's blue. At the end of the day, you're disagreeing with Dr. Robbie Erskine, who's had 30-odd years' experience in regional anaesthesia and has written the guidelines on things like prolocaine and the other two that I can't remember, whatever, you know, the list. I don't know of any other discipline that speaks about any other discipline or any other speciality that speaks so disparagingly of another speciality without actually getting them to comment or ask. Because I know there is banter within the bed Twitter community, but normally they ask another speciality. They don't simply say, and we're having a big issue in the UK of the consultant will say you're too fat. That's not your decision, it's the decision of a pre-AMS nurse and the anaesthetists. So, it wasn't intended to be nasty. I'm just frustrated that you're saying this is okay when the information that you gave me to say it was okay says, whoa, I don't understand how you're okay with those percentages, those figures. I just don't get it. So, I may have asked this already, but do you do fundals? Do you monitor blood pressure? And do you tell them that this is often painful? Because when we hear it's code in the UK of this is tolerated well means they just didn't sue. So I shall endeavour to actually get some better information after Christmas, but for now, that's it really. Anyway, thanks for the time, and didn't mean to be nasty, but just frustrated that the evidence is in front of your face and you will just carry on regardless. Thanks, bye.